Hey everybody, happy Friday. Sorry for the confusion. I had originally planned on heading out to do some of the weekend things that I need to get done after my very first Friday patient. But work has a little bit better of Wi-Fi, so I figured I'd actually stay here and do our live before I left the office. So anyways, first things first, as usual, I like to start with a couple of announcements. One of those being that when you come into the office now, please check out our summer hours as they are changing. This will be right above Jenna's desk, and it talks about the hours that Jen and I have. It does not include our functional health coaches as well as Lindsay or Joy because they do set their own hours. So if you have any questions for them, please contact them to set something up. But just to give you kind of a reminder, recap, I will be in the office Tuesdays through Fridays now, and Jen will be in the office Monday, Wednesday, and Thursday, and we have varying early versus late days. So there's plenty of hours and times for you to get in to see us. But today the plan is to talk about direct access. So this is probably a little bit more for some of my friends out there that are providers who would be making the referral for physical therapy, but it really applies to anybody because you should know what your access to physical therapy in the state of Ohio looks like. So let's just jump into it. It's going to be a quick one. Honestly, there's not much that goes into direct access. It's just a question that we've had throughout the week. But basically, direct access looks different in every single state. So some states don't have it at all. Most states do now. Direct access is the ability to go see a physical therapist, though, without a referral. So in the state of Ohio, what that looks like is that you can see a physical therapist within a window of 21 days. So at the 21-day mark, which it's 3 weeks, so it's a good chunk of time in terms of physical therapy. At the 21-day mark, there's a determination made as to whether you are improving or not. If you are able to continue with physical therapy as scheduled under your plan of care. But if you are not, or if the condition that you're seeing us for is worsening, likely we'll make the judgment call even before 21 days. But if that is the case, then we are required to refer you back to your physician or the appropriate specialist at the 21-day mark for further evaluation. That being said, the other thing with direct access is that when you come to see us, if you do not have a referral, and we use the direct access basically quote, or the direct access usage in the state of Ohio, we are mandated to notify your primary care physician or specialist that you are regularly seeing for your condition that we will be seeing you in our care. And it just looks like a very generalized plan of care. We send it out for what condition you have, as well as how long we expect to be seeing you for and what kinds of treatments we may or may not be doing. So that's pretty much all that direct access entails, but I do want to add a caveat there that direct access is a lot easier if you're talking about an out-of-network clinic like we are, because we don't worry about what insurance does or does not say. So you can come to us at any time under direct access, and that's not a problem at all. Where things get a little bit muddled up is with insurance. So I did want to talk about that really quickly, especially, like I said, for my provider friends out there, nurses, PAs, NPs, MDs, anybody that would be making the referral to physical therapy. So what I want you to know is that you should still encourage your patient to at least set up an evaluation, whether or not you have your referral fully, done, taken care of. They can still come in under almost every single insurance and at least have their evaluation done prior to us needing, that referral in hand. Now, a lot of insurances do not recognize direct access. They want you to still have the referral, preferably from an NP, a PA, or an MD. However, there are some insurances that do allow you or do recognize direct access. So It's going to depend on the individual whether or not they can come and use that benefit, but in most cases, they can at least come for their evaluation. So, I know most people will leave the office with the referral in hand, but if they don't, or it's delayed for whatever reason, please still encourage them to at least get their evaluation done and to look up their benefits, because they very likely do have direct access options. So that is my little caveat for this Friday. I know this was a quick one. Jen is on vacation, so let's all wish her a happy vacation. And it's shaping up to be a beautiful weekend despite the air quality. So, all right, everybody, I'm hopping off. Have a great weekend, and we will see you next week.